Dr. Susan, I just sent you a request right now. Can you please join us? Okay, perfect. From the beginning, I really apologize about that. Okay, so we're gonna talk today about two hot topics in medicine: IBS, Irritable Bowel Syndrome, القولون العصبي, والIBD, Inflammatory Bowel Disease, مرض تقرحات القولون وCrohn's disease that a lot of people are suffering from. والقولون العصبي اللي تقريبا 70-80% من الأطقم الطبية, 70 or 80% from the doctors here, whenever or whatever they push their hand against the stomach, they say, okay, it's IBS, without doing the exact investigations or lab work or imaging studies that we really need to exclude other things as well. اللي محتاجين نعملها عشان نستبعد أشياء أخرى. For example, Dr. Susan, we have a 20 years old female or 30 or 40, which is the age الأكثر شيء بنلاقي عنده ال IBS, coming from bloating, coming from pain in her belly. Okay, and the ultrasound السونار البطن والحوض is negative, سلبي, ما عندها شيء. The lab work like the CBC, CRP, the ALT, AST, which is the liver enzymes, كل المعامل والتحاليل بتاعتها منيحة, ما فيها شيء. Everything is normal. What's the next step that we should think about in order to diagnose whether to include or exclude IBS? إمتى نقول دي عندها Irritable Bowel Syndrome? What's the definition? What kind of symptoms that she have to show, or to include or to exclude the disease?
So with that patient in particular, for the bloating, you did the ultrasound, you did the basic labs, those are negative. The next thing that I would do for my patients here in the States, since it's readily available, is doing an upper endoscopy. So we want to look at their stomach to see if there's any signs of inflammation, gastritis, ulcers, and also if there's any evidence of celiac disease. Once biopsies.
Okay, that's very important. Let me translate that quickly.
Eliminate those.
Okay, let me translate that quickly, Susan, okay? Okay. Somebody saying خليها تتكلم عربي. هي ما بتحكي well, so I'm gonna help trying to translate everything. Okay, so she's saying we did an ultrasound, عملنا سونار بطن. People here in Egypt, when we say منظار, that okay, they freak out. They just leave the clinic. Oh my God, منظار? Why? What do I have? أنا عندي عشان تعمل لي منظار، أنا ما عنديش حاجة. Is it gonna be painful? Is it gonna hurt? Is it gonna damage my stomach? A lot of people they freak out from the endoscopy من المنظار. بيسمعوا كلمة منظار بيطلعوا يجروا على طول من العيادة. So can you speak a little bit about what's منظار? What's endoscopy?
Manzar endoscopy. Okay. Yani it's a procedure. It can be as short as 5-10 minutes. Yani it's done under sedation. You won't yani you won't remember or feel anything. And we pass a very, very small scope, maybe yani the size of the pen, very long, from the mouth down the esophagus into the stomach and the small bowel. If we see things that we want to take biopsies, yani the biopsies are literally the size of a pen, very, very small, very small. And then from there, we can see and take biopsies to help us determine what's the next steps to take in the workup. نشوف شو بيصير.
Exactly. فهي كاميرا صغيرة رفيعة بتخش من بق الإنسان في 5 دقايق، هو مش حاسس بأي حاجة خالص لأنه واخد بعد المعدة عشان trying to exclude celiac disease as well. Celiac disease ده gluten intolerance، نوع من أنواع البروتينات, kind of proteins that we have some sort of allergy towards it. So we have to exclude it before telling that the patient having IBS. We have لازم نستبعده ونعمل مناظير عشان نتأكد نطمن إنه قبل ما نقول للبيشنت you have قولون عصبي. What's next other than the upper endoscopy?
مظبوط. مظبوط. حكينا كرمال celiac disease، حكينا كرمال ulcers, peptic ulcer disease. بعدين the next thing I like to do for patients that are complaining of bloating, could this be يعني bacterial overgrowth, يعني an overabundance of the bad bacteria on your upper GI tract. بس كمان especially in the Middle East, I want to rule out H. pylori كمان. especially
of course.
H.
Oh my God,
pylori.
it's endemic here. Like 90% of the population, they have the
مظبوط.
bacteria حلزونية جرثومة المعدة, which is the H. pylori that you're talking about.
مظبوط. So if H. pylori is negative, celiac disease كمان negative, بعدين I like to treat for bacterial overgrowth. يعني with a medication. I don't know if it's ما بعرف it's
SIBO, you mean, right?
Yeah, for SIBO, مظبوط. But I like to then treat with a medication. I don't know is it موجود بإيجاب يا لا.
Rifaximin.
مظبوط. هيها for 14 days, 3 times a day. And the patients start that, and we see إذا بيحسسوا يعني بيصيروا أحلى من الدواء. إذا بيصيروا أحلى, that maybe is آخر مرة بشوفهم بالclinic. If they're not better, بيرجعوا. And then we go from there.
Okay, so basically you're saying that في بكتيريا ضاره موجوده في القولون وفي بكتيريا نافعه. البكتيريا النافعه عايزين نسيبها، بس البكتيريا الضاره دي بنجرب معاها نوع من انواع الانتي بايوتكس اسمه ريفاكسيمين. البراند نيم هنا في مصر اسمه جاستروبيوتيك او ترينسيديا. بنجربه for 2 to 3 weeks. بنجرب بنشوف لو الدنيا خفت يبقى دي بكتيريا نافعه، بكتيريا ضاره قتلناها. We got rid of it. لو لسه symptoms ongoing, we look more and do some more investigation. When do you do colonoscopy? امتى بتطلبي منظار قولون؟
Like as the patient بيجوا and they tell me they're having a change in bowel habits, and I see that they're having weight loss or diarrhea that's waking them up from their sleep, or blood in the stool, then I do a colonoscopy. But I don't do a colonoscopy right away if they don't have those alarm signs.
اوكي. سوزان بتحكي انه امتى بنطلب منظار قولون من المريض ايا كان هو مريض IBS او لا. لو في اي alarming symptoms. يعني ايه alarm؟ حاجه اديتك منبهات، دم في البراز، change in the stool caliber يعني تغيير في شكل الستول، constipation and it's not responding to treatment، امساك وغير مستجيب للعلاج الدوائي، الم غير في اسهال غير مستجيب للعلاج الدوائي، continuous diarrhea unresponsive to medical treatment، weight loss، فقدان وزن، appetite change، فقدان appetite، ما عندكش نفس انك تاكل. كل الكلام ده لازم نعمل مناظير برضو من غير ما الناس تخاف منها. حتى لو المنظار من فتحة الشرج، even if the endoscope, if the colonoscope is from the anus, you're not gonna feel anything because it's only like 15 to 20 minutes procedure maximum. And then you don't, a lot of people are asking me, do you feel something after the endoscopy? I say no, you don't remember anything because of this kind of medication that we give you. عشان الدواء اللي احنا بنديهولك انت مش داريان باي حاجه ومش هتفتكر زي Men in Black. Do you remember Men in Black?
Yes,
when
of
they
course.
put the pen like this and then push it, they don't remember anything.
مظبوط. لأنه the دواء that we give أول شيء الدواء Versed نعطيه so you have amnesia. You won't remember a thing. بعدين you get fentanyl or Demerol for the pain, so you won't feel any pain. So these two medications keep you comfortable and have no issues.
Exactly. Amnesia, it's the definition of amnesia is the loss of recent memory. You're not going to remember anything that happened in the last 10 to 15 minutes, whatever happened to you.
مظبوط. Most patients بعد الاندوسكوبي بيقولوا خلصنا والله خلصنا.
Exactly. We're done. Congratulations. Some of my patients, they say, oh my God, I didn't sleep that much for the last couple of weeks. Can you give me some at home? ممكن تديني شوية من الدواء ده عشان انام كويس زي ما نمت اثناء المنظار.
مظبوط. وكمان كمان during the procedure أوقات if the colon itself is looking normal, كمان I take biopsies نفس الشيء, very small,
microscopic colitis for example,
مظبوط, to rule that out. And patients ask, am I going to feel pain from this? No, you won't feel pain. You may have شوية دم after the procedure, but تخفف once it heals.
So I'm comparing between the US and Egypt. Okay. So once the patients here listen to the word biopsy, عينات, كلمة عينات, they freak out. Oh my God, I have cancer. No, you don't have cancer. We just take a routine biopsy, which is almost all the cases that we go inside the stomach or inside the colon. Because we went through the procedure already. احنا خلاص عملنا المنظار. طب ما ناخد عينات بالمرة. هيك نطمن زيادة. It doesn't mean like there is cancer or something at all. People freak out here. You can't imagine.
مظبوط. وكمان كرمال microscopic colitis, the colon itself, it looks normal. It looks healthy.
Looks normal.
We cannot tell. We have to ضروري ناخد biopsies تنخلي the pathologist يطلعوا تحت الميكروسكوب as if في microscopic colitis, as if we can give medications to treat it. If we don't take the biopsy, we won't know.
Okay, exactly. Yeah. So you first tried the rifaximin, the antibiotics for the bacterial overgrowth, for the bad bacteria. So what's the second line of treatment? What do you think? What kind of medications do you give for the IBS and everything?
For the IBS.
Oh,
كل شيء عملنا upper endoscopy, lower endoscopy, بعدين the ultrasound, بعدين the labs, بعدين I bring the patient to the clinic, بنحكي كرمال كل عملنا والآخري you have IBS. ياما IBS constipation, IBS diarrhea, ياما اثنيناتهم سوا. مظبوط. And we start نحكي what are the causes of IBS? أول شيء your microbiome. Is it something your microbiome is off? يعني the bad guys are more than the good guys. And how can we repopulate
the bad bacteria are more than the good bacteria inside your colon.
مظبوط. تاني شيء بنحكي كرمال your diet. Is there something
Someone is asking about the probiotics. Remember to talk about it, please.
Okay, طيب. Your diet. Is your diet something in your diet triggering the IBS? And lastly, we have to think about the things outside, stress, anxiety, things of that nature that also need to be evaluated and treated.
Okay, so microbiomes, I'm writing after you to repeat it in Arabic. Microbiomes, البكتيريا الضارة بالقولون ممكن تكون سبب. الدايت طبيعة أكلك اللي بتاكله ممكن تكون بتسبب لك الانتفاخات والألم بالبطن والستريس اللي في حياتك. ستريس نفسي، سايكولوجي في شغلك، في حياتك، ما بتنامش كويس، بتشرب كافيين كتير, a lot of soda, those kind of things. So, bottom line, we have almost always to do endoscopies. بدنا نعمل مناظير معدة وقولون قبل ما نشخص انه هذا الشخص عنده irritable bowel syndrome قولون عصبي، مش مجرد بالاعراض ونحط ايدينا على بطنه والسونار بتاعه منيح نقول له قولون عصبي. Right. Is that correct?
Correct.
Okay.
So, to answer the question about probiotics, yes, a lot of patients, كثير patients بيجوا عم ناخذ هالprobiotics اشترينا من هالمحل أنا ما بعرف شو فيها هالprobiotics. There's only so many probiotics that have evidence-based medicine for the things that we treat.
Great. That's awesome because all my patients, like we got this probiotic from the US and it didn't help. Most likely it's not going to help you. I mean, if you eat yogurt, لو أكلت زبادي بالليل, you get your own probiotics naturally.
مظبوط هيها.
It's sometimes it's overrated, It's
مظبوط كتير overrated. So I tell patients, okay, اشتريت the probiotic, it's غالي, it's expensive, it's not cheap. Exactly. Take it for the next 30 days. In her 30 days, حسيت صرت أحلى, okay, buy it again.
Sure.
If you
placebo.
didn't, placebo. If it didn't work, that's it. Don't buy it again.
Yeah, exactly. Yeah.
So,
yeah. That's what I tell my patients.
We start very high. I don't know the word in Arabic is conservative. I first start with the diet.
Okay. So, conservative is like you don't give medications, ما بتديش أدوية, بتقول له ظبط أكلك. Manage your diet first. So when do you refer to a nutritionist or dietitian?
Right away. Number one, I talk about nutritionist, the low Fodmap diet. I say patients, some patients will find their triggers. I had a patient who loved batikh. Batikh was their trigger. Another patient, everybody loves batikh. Another person, it was avocado. Another person, it was green peppers. They could eat the red peppers, but not the green peppers. And once they remove that from their diet, their IBS resolved.
Oh, that's awesome. Like we remove one or two items from the diet, نستبعد أكلتين بس من أكلنا والقولون العصبي يروح. Okay, do you believe in footprint?
بس تنحكي الشغلة before that is that people say it's a low FODMAP diet. It's not a diet يعني forever. يعني it's a misnomer. It's an elimination diet you do for a period of time to see if you can identify certain foods that are causing your IBS. I don't know how to translate that بالعربي.
Let me translate that. So في حاجة اسمها Fodmap Diet. Fodmap اللي هو fermentation, oligosaccharide, polysaccharide, whatever. نوع معين من الأكل لازم يبقى قليل عشان نعالج القولون العصبي. فالناس لما بتخش تقرا على الانترنت بتقول يا لهوي أنا هقعد الفودماب ده كله مكلوش وده كل الأكل اللي في الدنيا هتحرم من الأكل. لا، أنت you eliminate، أنت بتستبعد حاجتين ثلاثة at a time. ولما تيجوا تري-introduce تدخلهم تاني في اكلك، تدخلهم واحده واحده under the supervision of a nutritionist او dietitian،
مظبوط.
تحت اشراف حد بتاع تغذيه علاجيه، خبير تغذيه علاجيه، ونجرب ونشوف. فود ماب ده مشهور قوي للقولون العصبي، هبقى اشرحه بعدين في فيديو لوحده عشان الناس يعني دول abbreviation FODMAP it has to be low. ممكن الناس تخش على جوجل وتقراها.
وكمان في عنا هون بالستيت I don't know as a في بإيجيبت it's sometimes أوقات يعني very difficult for patients they يعملوا Fodmap elimination diet, so there's actually companies that make low Fodmap diets for patients to try.
We don't have this luxury here in Egypt. You know, we barely have the lactose-free, the gluten-free stuff, and not of all the in the hypermarkets. I mean, we wish we have Costco here, but we don't have.
Okay. So you were asking me about what food prints?
The footprint, like some sort of allergy test.
Okay. Patients always ask, is it an allergy? You can go to an allergist. They can do a lot of allergy testing. But what can I do with that allergy testing? I'm limited.
Exactly. That's what I say. Because here, the footprint is overrated.
It's
a lot of labs,
overrated.
they do it. ناس تقول لك أنا عملت تحاليل الحساسية كلها تجاه 200 نوع من الأكل. Towards 200 kinds of food. And I was allergic to 37. Of course, I mean, it's absolutely wrong. That's overrated.
It's so wrong. يجوا هيك عنا هوني with a book. يجوا لعندي with a book. I'm allergic to كل هالشغلة. And I say, wait, طولوا بالكم. What am I gonna? Yeah, me too. I don't want the book. If you waste it, well, you haram. You wasted your money. You really
wasted your money because it's not covered by insurance and it's not FDA approved.
مظبوط. All of the above.
اوكي مش جايين في الجايد لاينز، يعني حته الفود برنت الناس اللي بتعمل اختبارات حساسيه للاكل عشان القولون العصبي مش في الجايد لاينز بتاعت منظمه الصحه العالميه بتاعت الجهاز الهضمي خالص. neither in UK neither in the US ولا في انجلترا ولا في امريكا.
حالا مظبوط.
Okay good. So that's the IBS القولون العصبي.
I will see the microbiome.
Summarize. Okay.
So someone was asking, is live probiotics better than dry probiotics? You know, we have live probiotics and we have dry ones that we use specifically for certain things in GI. Once again, those are supported by evidence-based medicine. So whatever you get over the counter, dry, live, we don't know what it is. So I don't support taking it. وحتى if you have damage in your GI tract, some probiotics can actually make you very, very ill. حتى make you so sick that you end up in the hospital.
Okay, exactly. So somebody's saying I tested negative for celiac, however I tried to cut off the gluten. في حاجة اسمها non-celiac gluten sensitivity. So you don't have celiac, but you have
the intolerance.
They have the intolerance. انت عندك حساسيه من الجلوتين بس ما عندكش مرض celiac disease.
مظبوط.
Okay.
الأهم reason for the celiac to avoid it in celiac, the reason why we need to diagnose celiac disease and differentiate that from intolerance is celiac disease is a true allergy of the small bowel. And exposure to the celiac, the gluten, can increase your chances for small bowel lymphoma. That is the biggest concern.
So I want to comment on something. So a person with IBS لو واحد شايف نفسه ان هو عنده قولون عصبي وطلع celiac disease هو كده بيحط نفسه في خطر لو ما عملش منظار واخدنا بايوبسي اخدنا عينات انه يجيله لا قدر الله اورام سرطانيه في الامعاء الدقيقه which is lymphoma. People who are refusing the endoscopes are putting themselves at risk. المرضى اللي بيرفضوا المناظير لما الدكتور يقول لهم منظار يقول لك لا ما انا كويس دي شويه حساسيه. انت بتحط نفسك في ريسك عالي انه ممكن لا قدر الله يجي لك اي اورام.
مظبوط. اهم to do so the diagnosis, the gold standard يعني of celiac disease is endoscopy with biopsies.
With biopsies, exactly. That's awesome. So we almost summarized the IBS and the imaging studies. The ultrasound نعمله امتى؟ المعامل، التحاليل، الupper endoscopy, later on الcolonoscopy, and then we say IBS. مش أي حد عنده ألم في بطنه مرتين ثلاثة أو شوية إسهال أو شوية.
لا.
مش أي حد. Okay,
No.
good, great.
مظبوط.
Okay. يلا ننتقل بقى ونتكلم شويه على الاي بي دي inflammatory bowel disease والاورام الامراض المناعيه اللي بتصيب الامعاء الغليظه والامعاء الدقيقه. تعال نبتدي بالulcerative colitis. Let's start with the ulcerative colitis, which is a it's very dangerous disease. And I see a lot of patients are really suffering, especially in the ages 20s and 30s. So I'm gonna give you a case like the past thing. So 20 years old or 30 years old female coming with diarrhea, and she saw some bleeding or tinge of blood couple of times. واحدة عندها إسهال أو واحد عنده إسهال 4-5 مرات في اليوم، وشاف نقطة دم أو ما شافش، ممكن ما يشوفش نقطة دم مرة أو مرتين في خلال الشهر اللي فات. هنفكر إزاي عشان نفكر إن دي ممكن تكون ulcerative colitis أو Crohn's disease. How we're gonna think about it, the approach.
Okay, I will see if a patient comes and says, في عندي دم in دم. Number one, the stool خلاص. Number one, you're getting an upper endoscopy and a colonoscopy. Without.
I just want to hold here. So any kind of bleeding, ما دام في دم نزل في البراز لازم نعمل مناظير.
مرة يا مرتين شفته هيك, it doesn't matter.
People here in Egypt, they say, oh my God, I have piles, so it's my piles. Do you see it yourself? No. So how do you know it's a piles? We're not sure. Some people say, oh, I have anal fissure. Did you see it yourself? No. So why are you refusing the endoscopies? ليه بترفض المناظير وانت عمال حتى لو انت واثق 90% انه دي بواسير او شرخ شرجي لازم نعمل مناظير. Thank you, Dr. Susan, because
you're welcome. لأنه I had a patient like الصراحة 30 years old male اجى لعنا in California when I was training. كان معه high dam in the stool. Off and on, feeling fine. We told him you need to have a colonoscopy. He said طيب إيه. Then he didn't come back for 6 months. Finally came for the colonoscopy. We wanted to have it right away. Came back 6 months. صار معه rectal cancer.
Oh my. دكتور سوزن بتقول انه في واحد شاب كان بيعاني من نقطتين 3 دم، قالوا له يلا نازل نعمل منظار قولون، جري ما جاش تاني. بعد 6 شهور رجع، الدم زاد، عملوا له منظار لقوا سرطان في المستقيم، ده اول جزء من القولون. فالناس ما تستهونش من شكوى زي دم في البراز يعني منظار قولون، دم في القيء يعني منظار معده. ده الكتاب والعلم بيقول كده، ما تستهونش، ممكن تنقذ بيها حد من حياه الناس اللي حواليك او حياه نفسك. All right. Then.
All right. So first, we do the upper endoscopy, we do the colonoscopy. That's how we're going to find out, are we dealing with ulcerative colitis? Ulcerative colitis, يعني it only affects the colon. I don't know if you want to translate.
مرض التقرحات القولون اسمه تقرحات قولون، هو بيصيب القولون فقط وهي الأمعاء الغليظة.
And the ulcerative colitis يعني ulcers that start in the rectum and can spread throughout the entire colon.
قرح ممكن تبتدي من مستقيم وتفضل مكملة للقولون كله.
And what's also very important during the colonoscopy is we have to get into the last part of the small bowel, which is called the terminal ileum, to look for Crohn's disease, which is also a type of inflammatory bowel disease.
واحنا بنعمل منظار القولون بنسرق حته من الامعاء الدقيقه نخش فيها اسمها الصائم او اللفائفي، بنخش ناخد منها عينات عشان ممكن هي تكون متصابه بمرض اخر من المناعه اسمه كرونز ديزيز. مش تقرحات القولون اللي في القولون فقط، ممكن تبقى حاجه اسمها كرونز في الامعاء الدقيقه كمان.
وكمان Crohn's disease is different than ulcerative colitis لانه Crohn's disease can affect any part of the GI tract, from the mouth, esophagus, stomach, small bowel, colon, anus, كل شيء.
الكرونز ديزيز ممكن يصيب اي حته في الجهاز الهضمي كله، مش مجرد القولون بس، ممكن المعده، الاثنى عشر، الامعاء الدقيقه، المريء، كل حته. Okay, I see a lot of patients are on steroids for years.
That's wrong. Wrong.
So, tell me more about the steroids. How do we use it during the attack only, because it has a lot of side effects?
مظبوط. أول شيء
it's abused here.
It's يعني we see it here too كمان لك الصراحة. So think of the Crohn's disease or the ulcerative colitis مثل like a fire, نار, okay? The fastest way to put the نار out is to give prednisone, to get it under control, to get it هيك صغيرة. And then we start the maintenance medication to keep the نار under control.
Okay, let me translate this. الكورتيزون في الأمراض المناعية هي عبارة عن كأنه جبت طفاية حريق بتطفي فيها نار لهيب during the attack أثناء النوبة بتاعة مرض تقرحات القولون أو Crohn's disease. بس during the attack for 2 weeks, 3 weeks, up to a month plus or minus.
مظبوط. مظبوط.
Okay.
And then from there you see how the patient responds to the steroids to determine how aggressive you need to be with your maintenance therapy. يعني do you do like the azacol, mesalamine, يما you go immune modulators or biologics.
بتشوف استجابت ازاي للكورتيزون عشان تشوف استجابته للعقاقير الثانيه او الادويه الثانيه اللي هي مثبته المناعه هتبقى عامله ازاي، على حسب استجاب للكورتيزون في 3 4 ايام ولا استجاب للكورتيزون في 3 4 اسابيع.
مظبوط مظبوط. So
Okay.
from there, so I see a lot of patients that will come in only on steroids, a very, very low dose, but that's not right. Because
Absolutely wrong.
Because steroids actually long-term can have very destructive effects when taken long-term. To the bone, the eyes, the kidneys, the blood, كل شيء.
الكورتيزون ممكن يدمر حياتك وانسجه جسمك كلها وعظمك ومخك ونفسيتك وعينيك وكل حاجه ومعدتك والجهاز الهضمي اللي انت بتعالجه بالكورتيزون ممكن اكشلي الكورتيزون يقلب عليه ويدمره لو انت فضلت ماشي عليه فترات طويله. I just got a patient last night at the clinic. Our clinic series at night. I know you don't have clinic at night unless you're on call or something. So I got this patient 75 years old at 9:30 p.m. and she was on steroids for the last 4 years. Because she have ulcerative colitis. 4 سنين على كورتيزون. She was like, my doctor told me never to get rid of the steroids. 10 milligrams of Soluprep.
Oh, that's wrong. So wrong.
Yeah. So what's the role of Pentazer in Crohn's disease? دواء اللي اسمه Pentazer في Crohn's.
Pentazer. So Pentazer, the way that Pentazer is made, يعني, if it's released in the small bowel. So it's directed in the small bowel. So if you have a very, very mild Crohn's disease and you responded very quickly to the steroid, that might be a good option for you.
Okay. But some of the new guidelines for the Crohn's disease, especially in UK, they say the 5-ASA, the
doesn't work.
Salicylic acid,
like
is not working with the Crohn's. But the people who were taking Pentazer continue on it, but do not start it initially.
مظبوط. So I'll get the patients, they don't want to do biologic or immune modulator. So you have to put them on something, and they're sometimes more agreeable to the Pentazer because it doesn't affect the immune system.
Okay. The Pentazer مش بيأثر على الاميون سيستم زي الادويه البيولوجيه اللي البيشنت ساعات بيرفضوها، يقول لك لا انا مش عايز علاج بيولوجي، جرب لي اي علاج وخلاص بس مش عايز علاج بيولوجي.
مظبوط.
Okay. I have a question here. Is Crohn's disease is curable 100%?
Well, unfortunately, Crohn's disease is not 100% curable, but we have medications, Yani, to get you feeling like you don't have the disease. So my goal is to find the right medication for you, that the only time you remember that you have the disease is when you have to take your medication. Then I'm doing my job right. And you're living your best life.
Great. So try to ameliorate and live the best life, but it's not curable 100%, neither the Crohn's, neither the ulcerative colitis, unfortunately.
Ulcerative colitis ulcerative colitis is curable if you can get your colon taken out. That's
okay. If you cut the colon, لو شلت القولون كله بعملية جراحية ساعتها خلاص انت خفيت من ulcerative colitis.
مظبوط.
But I mean it's not always the solution.
But I mean it's not always the solution, but some people have such aggressive disease when they present that they don't respond to anything, and we have no other choice than to take their colon out.
Yeah, exactly. What's the role of food? What kind of food in the IBD? Usually, does it help or not?
Okay, so IBD and food is a very, very hot topic. And one of the big pushes right now is the Mediterranean diet, which is high anti-inflammatory, low pro-inflammatory. Your diet. Avoiding a high-fat, high-processed food diet. There's several diets out there right now that a lot of patients have tried in some studies. The specific carbohydrate diet, the inflammatory bowel disease anti-inflammatory diet, and now the Mediterranean diet, which is very beneficial. Now, some patients can have both IBD and IBS.
بعض المرضى ممكن يكون عندهم امراض التقرحات القولون او كرونز ديزيز ومعاهم قولون عصبي الاثنين.
مظبوط. So it's important
so
to
what
identify.
Susan, let me translate the food part. So Dr. Susan is saying, so processed food اللي هو الاكل اللي فيه معلبات ودخل فيه مراحل كتير عشان يطلع لك زي اللانشون والتركي والحاجات الكولد كاتس والكلام ده كله، والحاجات اللي فيها فات دهون كتير اللي احنا بنسميها عندنا المسبك والمحبك والملبك والمشبك. اوكي يعني بالاصح الاكل المسلوق ومشوي هو احسن حاجه، والاكل الميديترينيان اللي هو حوض البحر المتوسط، الاكل اليوناني المصري الجزائري المغربي الكلام ده كله.
مظبوط.
Okay.
So that's a very hot topic. And then also, so we're seeing a rise in inflammatory bowel disease in other countries as they adopt our westernized high-fat diet, high-processed diet, unfortunately.
وبنشوف كمان كميه امراض تقرحات قولون وكرونز ديزيز في حوض البحر المتوسط كمان، لان ابتدوا بقى ياخدوا من بره من امريكا ومن انجلترا البرجرز والوينجز والبطاطس المحمره والفراخ البانيه والحاجات البروسيس فود اللي كلها المحمر والمشمر والكلام ده كله، فابتدينا نشوف الامراض دي عماله تزيد لان ما بناخدش بالنا من طبيعه اكلنا. we don't maintain a good healthy lifestyle or doing a lifestyle modification.
مظبوط.
Okay, good. So how often do we do colonoscopies for the ulcerative colitis? امتى بنعمل مناظير قولون الulcerative colitis?
Well, it all depends. Well, first of all, when I have a patient who initially gets diagnosed with ulcerative colitis, we have our first colonoscopy, then we start them on treatment, and then 6 months to a year, I need to see if they've actually responded and that their colon is healed.
Okay, so actually I got a patient a week ago. Last colonoscopy that she did, she's 47 years old. Last colonoscopy she did was 15 years ago.
Well,
can you give me your comment?
Okay, so first of all, she had 15 years ago. She's had the disease. How long has she been diagnosed with the disease?
Since she was 18.
Since she was 18. So she should have been having screening colonoscopies every 1 to 2 years, 8 years after diagnosis.
Okay, so for example لو حد اتشخص عنده قولون تقرحي عنده 20 سنة، بعد كده يعمل بعدها ب6 شهور لسنة، وبعد 8 سنين يعمل كل سنتين. يعني الناس اللي عدت 8 سنين متشخصين بمرض ulcerative colitis they have to do colonoscopies، لازم يعملوا مناظير قولون كل سنة لسنتين.
مظبوط.
الناس بتجيلي عندهم 5 و10 سنين عدوا على ulcerative colitis ورافضين لسه المناظير. Okay, that's for the ulcerative colitis. What about the Crohn's? بالنسبة للكرونز كل قد ايه يعني؟
If the Crohn's يعني affects the colon, نفس الشيء مثل ulcerative colitis.
اوكي، لو الكرونز برضو مأثر على القولون، لان احنا قلنا هو ممكن ياخد الامعاء الدقيقه او المعده او اي حته في الجهاز الهضمي، برضو هيعمل بعد 8 سنين من تشخيصه بكرونز او الالسرتيف كولايتس لازم يعمل مناظير القولون كل سنه لسنتين.
مظبوط. If the Crohn's disease بس بالterminal ileum يعني كل 3 سنين.
كل 3 سنين لو الكرونز ديزيز عامل اصابه للتيرمينال إليوم اللي هو الصائم اخر جزء خالص موجود في امعاء الدقيقه، يعمل كل 3 سنين مناظير.
But it's very important.
We had to do this awareness, Susan, because not people here in Egypt or in the Middle East, they don't know how often should they do the endoscopies. They just refuse the idea of something is gonna be, I mean, inside me. Sorry for
like
that.
مظبوط, but it's very important. Don't forget we're doing other things to monitor the disease. We're doing labs, we're doing stool studies, we're doing imaging studies كمان. It's not بس هيك يعني colonoscopy وبس. لا, في other things ضروري تنعمل to make sure that inflammation isn't just active that can cause complications related to the disease.
Exactly. دكتور سوزان بتقول انه في حاجات تانية اخرى غير المناظير لازم نعملها كاشعاعات مقطعيه او رنين مغناطيسي او تحاليل في الدم. So I'm talking specifically about the colonoscopies and endoscopy, Susan, because people here refusing any kind of procedures. They do the calprotectin, the CBC, CRP. They take the dive to do the CT scan and the MRI, but they refuse the endoscopy, which is one of the most important part of the diagnosis and the follow-up. For the IBD.
We have to look. We have to see. Like أوقات في ناس they can say, oh حسينا we're better. I feel so much better. We go in, we do the colonoscopy. It looks awful. So مش ضروري يعني you might feel good and your colon look the same. It's not the case. You could feel good and your colon look bad. You could feel good, your colon looks great, or you could feel bad and your colon looks normal.
Let me translate this. It's very important actually. Thank you for mentioning that. So سوزان بتقول انه ممكن يكون المريض بطنه بتقطعه وعنده سيمبتومز واعراض رهيبه ونخش بمنظار القولون نلاقي الدنيا زي الفل ما فيهاش اي حاجه خالص. وممكن يكون انسان سليم ما عندوش اي اعراض تماما وجه معاد المنظار القولون بتاعته نخش نلاقي فيه كوارث جوه. فهي مش بالاعراض، هي بالكتاب والجايد لاينز والعلم بيقول كل كام سنه لازم نعمل الكلام ده، مش عشان انا كويس خلاص. I want to talk about the screening colonoscopy, please. Because here we don't have the screening colonoscopy. We don't have something called screening colonoscopy. Yeah, about 45 years old or about 50 years old, any patient that I say ممكن اقول لهم فوق ال 45 50 لو سمحت ممكن نعمل منظار قولون عشان نطمن، بيقول لي ليه يا دكتور هو انا بشتكي من حاجه؟ They say why doctor? Do I suffer from anything? I'm absolutely fine. Why should I go through this procedure?
Like,
so can you explain that, please?
So it's well, I'm surprised. هاي أول مرة بسمع ما في screening colonoscopies عندكم. So هون عندنا حتى the screening colonoscopy is very, very important to stop colon cancer. So everyone who's healthy, doesn't have a family history, needs to undergo a colonoscopy. And the guidelines right initially, as a year ago, we're starting at the age of 50. But 50. With our information
45.
and the new findings, لازم نبلش 5 سنين earlier. Now 45 years old.
Can you translate that in Arabic? People
yeah,
like
right.
It very
Go
much.
ahead. Please translate for me.
No. Can you translate
it?
Okay, Susan is saying that أي شخص كان فوق لغايه السنه اللي فاتت، اي شخص فوق ال 50 سنه لازم يعمل سكرين كولونوسكوبي، لازم يعمل منظار قولون عشان نطمن عليه ونقدر نستبعد اي وجود اورام لا قدر الله خبيثه او حميده في اولها نقدر نستأصلها، او زوائد جلديه او زوائد لحميه ناخد منها عينات او نستأصلها. السنه اللي فاتت اكتشفوا انه احسن نخليها 5 سنين بدري عن سن ال 50 كمان، عن سن ال 45، عشان لقوا انه دي بتفرق في حياه الانسان والكانسر ديتكشن فيه، زي فكره الماموجرام كده عند السيدات. After the age of 35, I believe, they have to do the mammogram every 1 to 2 years. So here, the old 90% of the ladies, they didn't do they don't even know what the mammogram is.
So the way we stop colon cancer is we start doing these screening colonoscopies. We do your colonoscopy. We find polyps, depending on their size and the type of polyps and the number of polyps, helps us to determine when you do your next one. It's not yani one and done. No, it's just determining when do we do your next one yani.
Exactly. أهمية منظار القولون يا جماعة بعد سن 45 عند الرجال والسيدات مهما كان بيعاني أو ما بيعانيش من أي أعراض أو من أي أمراض، مهم قوي، بتنقذ حياة إنسان وبتأثر في مستقبله. أنتوا مش فاهمين إزاي؟ مش فاهمين فكرة المناظير زي ما قالت سوزن، ما بنحسش بحاجة، نايمين مش حاسين بحاجة، بناخد حقنة منومة، أنت مش فاهم، مش بتحس بألم حتى بعدها.
It's a very, very preventable disease, and we are reducing the rates of colon cancer, but not enough.
Exactly. بنقلل من الكولون كانسر، من سرطان القولون، من الحدث بتاعه، لأن أي حاجة في أولها بتتنحت زي ما قلنا، بنستأصلها، بنشيلها، غير لما نخش على سن ال 70 بمنظار قولون نلاقي تيومر قد كده وتو ليت ان احنا نستأصله او بناخد منه بايوبسي وبعد كده بنقول له.
اليوم كان عندي شاب اجى for his screening colonoscopy. Last time he had it 10 years ago. ما كانش عنده شيء. اليوم كان عنده 3 polyps, very, very big, very big. I had to remove them piecemeal, بعدين tattoo the location وبعدين clip. لأنه it's such a big defect. So just because you have one and you didn't have any doesn't mean the next time you're not going to have any.
exactly. مش عشان عملت مره واحده منظار قولون وانا عندي سن 50
ما في
وبعد كده
عندي.
اقول خلاص ما في عندي مش هعمله تاني. لا, you have, if you're absolutely you're healthy and you're fine, you have to do it every 10 years, right?
مظبوط. So بعدين, now if you have a family history, if you know your family history, someone has colon cancer, you do it either starting at the age of 45 or 10 years before the diagnosis. Let's say somebody had colon cancer at the age of 45. Then you start doing your colonoscopy at the age of 35. Yeah, your mom, your dad, brother or sister.
سوزان بتقول انه لو في الاب والام مصابين بمرض سرطان في القولون او حتى في الجهاز الهضمي تحت السن ال 55 50 45، انت لازم حتى ما تستناش لسن 45، لا انت عند سن 35 10 سنين قبل ما التاريخ عند الوالد او الوالده تشخصه، 10 سنين قبل بتعمل منظار القولون، حتى لو عندك اي جينات وراثيه ممكن تصيب بسرطان القولون كمان. There is a very important question here. What's the probability of ulcerative colitis of turning into cancer colon?
So Hanshi, the reason why we do, so to start, the reason why we need to get your ulcerative colitis under control is to stop the inflammation. When you have active inflammation that's in the colon, that's ongoing, you're turning over these cells that are uncontrolled, that increases your risk of colon cancer. So you must get the inflammation under control. We must do the colonoscopy, that it's under control. And then we have to also do every 1 to 2 years to make sure there's no colon cancer or dysplasia that's going on and find it. And that's why we do surveillance biopsies, yani, throughout the procedure, which can take a very long time, but it's very, very important.
Like for example, this removal of 3 piecemeal polyps and tattooing, I believe you spent like more than 45 minutes at least.
مظبوط. Tattoo, بعدين الراسنا, بعدين the clips, بعدين going back to the location and finding. It takes time.
That's an hour plus for me. It's an hour plus.
It's an hour. أكيد.
Yeah, that's awesome. Very beneficial to have this kind of conversation and awareness, at least here in Egypt and for the Middle East as well. Because when I say to people you have to do colonoscopy every year because you have ulcerative colitis, they're like, are you crazy, doctor? Are you commercial? Are you trying to?
No, it's because we are trying to help prevent colon cancer.
Yeah, exactly. I hope people understand that. I will save this video with every single thing that you said, Susan. Thank you very much for. I'm glad that we had this great talk today. And I'm looking forward for the engagement actually and the comments and the numbers of people that they're showing.
I feel so bad that we didn't get a chance to just answer people's questions. I would love to do so.
So let's do that like in a month or so and answer every single question that the people ask. هنرد كمان شهر انا وسوزان نتقابل تاني ونرد على كل، انا اسف جدا ما قدرناش نرد على كل الكومنتس، بس هنتكلم على كل الكومنتس اللي سوزان بتقولها الشهر الجاي، ومش هنتكلم على توبكس بس، نشوف نلاقي اسئله ونرد عليها. questions and answers Q&A.
انبسطنا كثير. شرفنا.
شرف إلنا.
يا هلا.
All right.
يلا
see you next month then.
خير.
All right. Have a good night. وانتي من أهله. باي باي.
باي باي.
باي باي.